now have a triangle. Okay? So everybody should be able to find those. You're going to be using the lateral epicondyle for your flexion and extension of the elbow. Okay? For the wrist, got your ulnar styloid, which everybody can probably see that and feel that. Your radial styloid is on the other side, right here. Okay? Anybody know what Lister's tubercle is?
We knew it last summer.
You knew it last summer. So Lister's tubercle, if you go to the back of your wrist and you feel your radius down towards the end and go towards the ulna, anybody feel a little bump right there? Yeah. Okay, that's Lister's tubercle. Anybody know what that does? Shout it out. So what that is it is like a pulley for the extensor pollicis longus. Okay, it comes all the way over here into Lister's tubercle. You don't need that for any identification for range of motion or anything. It's just one of the bony prominences that you might feel, and I wanted you to know what it was. Third metacarpal. Which one's your third metacarpal? Third metacarpal is your bird finger. 1, 2, 3, 4, 5. Third metacarpal is your bird finger. Okay? If you go down and palpate your third metacarpal and go all the way to the base of it, you should feel a divot. If you move your wrist forward and back, you can usually feel it a little bit better. Right underneath that divot is the capitate bone. This is the axis that you use for ulnar and radial deviation. So you'll need to be able to palpate that. Okay? And I can come around and help you find it. It really, can you see my fingers indented here? Okay, so here is your third metacarpal right here. And if you palpate down at the end, you see how you can feel the base of the third metacarpal? It's really easy to find. Right up underneath there is your capitate. And if you kind of bring your wrist up and down, you'll feel that divot get a little bit larger. Okay. Can't get it this way. See it? Okay, that is your axis for your ulnar and radial deviation. Yeah. Okay. Next is the hand. You've got, again, digit 1, 2, 3, 4, 5. Okay, it's easier than saying thumb, index finger, middle or long finger, depending on who you're talking to, ring finger, and small or little finger. Can you see how that can be a problem? If somebody calls this the LF, and somebody usually refers to this as the LF, little finger, you're going to get confused. So the easiest way is digit 1 through 5, okay? So your first joint here is your metacarpal joint here. On the thumb, the first joint is the Carpometacarpal joint, or the CMC joint, metacarpal. This one is called the Interphalangeal joint, or the IP joint. On your digits 2 through 5, you've got the PIP, the Proximal Interphalangeal joint, on all those, and then the Distal Interphalangeal joint. Okay? So those are the landmarks that you're going to need for your range of motion. All right? Any questions so far? No? Okay. So we're going to start with happen to have an area where you've got an arm on the chair or something like that. It's easier to do in standing. Okay? So we'll start in seated. We'll bring the chair up here. gonna have you turn facing that way. Jordan's recording over here. Okay, so again, we're gonna screen for the motion. You straighten your arm as much as you can and bring it up as far as you can. Very good, okay? We're gonna find our axis point, which is the lateral epicondyle of the humerus. Your axis is going to go across there. Your stable arm is going to go parallel to the humerus. Your movable arm is going to go parallel to the mid portion of the forearm, okay? So for flexion, could you bring your arm up as far as you can go? And again, you want to make sure that you adjust because like I said, those move a bit. And you're going to come up. And she has about 143 degrees of flexion, okay? So here's my 0. And here's my 140 normals. I put 130 to 150. Anybody have an idea why? Sorry?
Double joint.
No, this is for flexion. What could get in the way of flexion?
Muscles.
There you go. So if you've got somebody that's got a really big bicep, they're going to be closer to 130. You get somebody small that doesn't have a big bicep, they're going to be closer to 150. Okay? All right. Any questions on elbow flexion? It's very straightforward, very easy.
Did you start at 90?
Nope, you start.
Okay.
You start at 180. Your 0 point is up here. So make sure that with this one, you follow your 0 point on this end as you're going up. So always look at where your 0 point is when you're doing your motion. Okay? If we're starting here, our 0 point's down here. Okay? So that's elbow flexion. For elbow extension, again, the same landmarks. These are going to be easy for you guys because it's flexion and extension, the same landmarks. Forearm, pronation, and supination have similar landmarks, whereas flexion and extension have similar landmarks. Ulnar radial deviation, so they're all very easy to do. All right, same landmarks, and if you'll look and see, let me show you on this side over here. The easiest way I have found to make sure that you're lined up, you see how I'm holding the goniometer down here? So I can tell I'm lined up. So in this position, can you straighten anymore? So she has about 10 degrees of hyperextension. Okay? That is written plus 10. Okay? Plus 10, hyperextension. Hyper is more. If I were to write minus 10, that would mean that she has an extensor lag. She can't get to full extension. It can be a joint issue, it can be insufficiency of the muscle. Okay? I would know that if I went to passive range of motion, I would know if we got to 0 that she had full joint motion, so it must be lack of triceps strength. Okay?
I definitely have that issue.
Okay, so that's elbow flexion and extension. Why don't you guys practice? We're going to be doing forearm pronation and supination. This goniometer. Okay? As you can see up here, I have actually used the picture from the Clarkson book, because the one that's in the Pedretti book is not how you'll see it in a hand therapy clinic. Any ideas why? Okay, so in the Pedretti, if you look at the Pedretti, they do it like this. For supination, they do it like this. For pronation, they do it. So the stable arm is down instead of up. Okay? So if I'm doing pronation and supination and I lack motion, I can still pronate and supinate by doing internal and external rotation of my shoulder. So if I am lining my goniometer up with your humerus, I am in essence taking that compensatory motion out of the picture. Okay? Another thing I usually do you see how he's holding his arm here? That's a cue for them to not rotate out. So how do we tell them not to rotate in? Thoughts? Speak up. Yep. Make sure your elbow's locked into your side and hold it. Okay? Because if it's locked into their side, they can't rotate the shoulder. Okay? Yes?
At my internship, they used to just put a towel right there and they would have to like hold it, so that would like ensure.
Yeah, that's another way you can do it, is you can put a towel in there because then it's clamped in. So that's, you just want to be cognizant of the fact that people will compensate for lack of motion. So internal external rotation of the shoulder is forearm and pronation, compensatory motion. Okay? So what we're gonna do, okay, so supination, normal is 0 to 80 or 90 degrees. 0 is your neutral position, okay? We're not asking you to start in a neutral position, okay? But you do want to screen. Can you turn your palm up? Good, and back to neutral. Okay, so what you're going to do is you're going to take the stable arm here, and you're going to, you've got to get down at eye level here. You're going to line it up with the humerus, okay? Turn your palm up for me. You're going to lay the movable arm right across this distal crease of the wrist. And her range of motion is right at 90 degrees. Okay? So you want to really make sure that you're lining the stable arm up with the humerus. Okay? So let's do pronation. Can you turn your palm down? Good. And then back up. Okay, good. Now this time when you do it, I want you to try and compensate. So turn your palm down. Bring the arm out like you're.
Yeah.
Okay, so see, now if I line up with the humerus, I'm actually getting her at 60 degrees of pronation. Bring your arm back in. If we keep it locked in there, can you hold on to your arm? Down here. Good. And then now turn your palm down. She's at 65 degrees. You need to work on your pronation. Okay?
It's very tight.
So, yes,
For biomechanics, is that okay to bend like that to be eye level?
yeah, that's fine. I'm not hurting my back or anything like that. It's not like I'm putting resistance and I'm kind of supporting, but you've got to get at eye level. The other thing you can do is you can get down like this. Usually that's what I do because they're sitting in a chair and my chair is behind the table. So, and you also want to make sure that we're coming up here at 90 degrees of elbow flexion. She's trying.
It's so hard.
Okay, about 60 to 65 degrees. Okay, so supination is palm up. You guys heard the old saying, supination, you can hold the soup. Okay, pronation, palm down. Stable arm is along the line with the humerus, and the movable arm either goes across the volar portion of the distal or the wrist crease, or across the dorsal portion. Okay, dorsal portion. You want to be right at the distal radial ulnar joint, just beyond it. So the radial carpal joint. Okay. Make sure that you're not on the other side of the radial styloid. You're beyond it, just distal. Okay. Any questions on this one? No. Okay. You guys can practice. Wrist flexion. So, if you look in like Andretti or Clarkson, they measure completely different. This is from the American Society of Hand Therapists and the American Society of Hand Surgeons. This is the way they want us to measure, and they want it to be consistent. Okay? Do we have a towel up here anywhere?
You can use my sweatshirt.
So this is one where it's better to have your client sitting. Most of the time when you're taking these measurements, you're going to have your client sitting at the table. Okay? You're going to be across the table from them. I'm not across the table from her. All right. Wrist flexion. Can you move your wrist forward like this? bend it back. Okay? The axis, make sure I'm saying what they say. Dorsal central wrist. So where the wrist bends. Now, you are going to see most hand therapists do it up here like this. Okay, we're gonna do it here. Bring your wrist forward as far as you can go. Basically what you're doing is your stationary arm is parallel to the mid portion of the forearm. Your movable arm is going along the third metacarpal shaft, okay? Your axis is then at the bend of the wrist, basically, okay? So you wanna make sure that you're here snug, not back here like this. It's very easy to just slide your goniometer forward, and as long as you've got the movable and the stationary arm where they're supposed to be, you should have good range of motion and accurate, 75 degrees, okay? Now, when you're doing wrist flexion and extension, you kind of want their fingers to be relaxed. You don't want them in a fisted position because remember, active and passive insufficiency of the wrist, okay? So, for wrist flexion, just have them relax the fingers and bring it forward. Okay. Snug it up there on the third metacarpal along the mid part of the forearm. And we even got 80 degrees that time because her fingers are relaxed a little bit more, okay? Wrist extension is the same thing, but on the volar portion instead of the dorsal portion. Again, the fingers need to be relaxed. The issue here is if your fingers are relaxed, how do you go along the third metacarpal? Because if you have your fingers straight, you're going to get some tightness in the wrist flexors because the fingers are straight. So you want them relaxed so you can go full range of motion. So what we do is we take the movable arm and we put it between the first and the second. Or I'm sorry, the second and the third digit. Okay, bring your wrist back. Okay. And she's got about 80 degrees of extension. Now, let's go again. Keep your fingers straight and bring it back. So if I'm going along the third metacarpal and her fingers are straight like that, she's got 65 degrees. But when she relaxes her fingers, she gets to 80. Do you understand now why it's important for the fingers to be relaxed? Okay? You want an accurate motion of the wrist without the muscles impeding. Okay? All right, that's wrist flexion and extension. You guys want to practice that? Mm-hmm. Okay. Use that one if you want. I always use this one. One you've been using.
Yeah.
I don't like that one. I don't know why, but I don't like it. That's just me, personal preference. Okay? So, again, if you want to have a seat.
Do you need my chair? Okay.
All right, this is the one that I taught you guys about finding that capitate. Okay? So you're going to just palpate down, and you kind of have to push a little bit hard, just so you can feel that metacarpal. And then at the base, there's a divot. Okay? It's where your axis is going to go. Your stable arm again is going down to the mid portion of the forearm. Your axis is going over that capitate. I do it just like this. The movable arm is going along the third metacarpal. If I grab a hold right here, I'm holding the goniometer in position. Okay? So ulnar deviation is the first one up there. You're going to ask them to move their whole hand, not their arm, towards their small finger. She is at about 38 degrees. 30 is normal. You will find a lot of people with up to 40 or 45 degrees. Okay, back to neutral. So here's my 0. And we're starting at 0 just as our starting point. All we're going to record is the end range of motion. Okay, turn towards your thumb, please. Good. And she's at about 25. All right, so, and this is normal is 20, 0 to 20 for radial deviation. Okay, and back to neutral, please. So, this is real easy to do. You can do both of them at the same time. Very quick. You're not even moving the goniometer except for in the movable arm in each direction. Now, what you want to make sure that they don't do is compensatory motions. Can you show us some compensatory motion? You see how I'm holding her arm here? Or a lot of times they'll go like this. They'll cup their palm. So you want to make sure that you tell them, keep your palm flat on the table. And you can put a towel down if you want. Or I usually have a towel down when I'm doing range of motion. But you can put a towel or a pillowcase down so that they can slide a little quicker or easier.
Sometimes they move their shoulder.
Yeah. You'll see all kinds of compensatory motions. And I always tell them, this is a very small motion. It's not expected for you to have 100 degrees. It's 20 degrees one way and 30 degrees the other. It's normal. Okay? It's real easy. This is a real easy one. This is where we'll stop today. Tomorrow we'll be doing range of motion of the digit. Is the first thing we're going to do is we're going to do Metacarpophalangeal joint, MPJ, PIPJ, and DIPJ. Okay? We're going to do the metacarpal flexion and extension. Okay? I'm going to tell you up front, we usually don't do extension in the hand therapy clinic unless there's a huge lag. Okay? And again, we're doing that because we want to figure out, is it a muscle issue or is it a joint issue? Okay? So for MP joint, how do they have it up there? They have it laying down. You can do it up like this. I find it easier to do it up like this just for me because I can see the goniometer. Okay? Or you can do it down like this. Okay? So, I gotta get my glasses. Hold on. Getting old stuff for the cards. Don't do it. Okay, so we still have a movable arm and we still have a movable arm and a stable arm, okay? They don't change just because we clipped it, okay? So you're going to start, I usually start with my clients, I just have them make a fist and back out, okay? And then what we're gonna do is you're gonna align the stable arm along the metacarpal of the joint you're measuring, or the digit you're measuring, okay? So the first, and when we do this for the practical, we're gonna ask you to measure one. I'm gonna ask you to measure them all, okay? So basically, just like we did with the wrist, it's a matter of going into the position, so if you'll bring it in, and just taking your little goniometer and hugging it. Just like we did for the wrist yesterday, okay? So we've got 85 degrees, okay? Make sense? These are really, it sounds like it's complicated to do the digits and the wrist and everything. They're really very straightforward. It's not like the shoulder where you're doing all different kinds of motions, okay? So that's MP. You can measure extension. It's just easier for you guys to see it this way by going on the volar surface. So bring it back as far as you can go. And there is hyperextension of that joint, usually in the index finger. But the way that they sometimes will measure it is on the side. And if you measure it on the side, you can do the index finger or digit 2 and digit 5, but you can't do the other ones because you can't put it on the side of them. So it's easier just to go ahead and do them all volar, okay? So if we ask you to show us NP joint hyperextension or extension, you just need to do one joint. Again, you're using the same landmarks, okay? We're going along the metacarpal of the joint or the finger you're measuring, and you're just, wherever it's bending, which is at the joint itself, is where the axis is. And then we're going along the proximal phalange of that finger, okay? So she's got almost 35 degrees of hyperextension, okay? So that's the MP joint. So again, I'm gonna put her up here so you guys can see it. You can measure it here, you can measure it here. Either way, we're not gonna take off for it, okay? So again, you're straightened, and you can, if you want, measure extension on the back of the finger. But if you look, like even at her finger, how she's got like a little bit of hyperextension of the DIP joint,
it's going to sometimes block your actual movement because of the goniometer. So we're just going to look at flexion. I have my clients just flex like this, okay? And again, you put the down as far as you can go. You just put the goniometer on the proximal phalange for the stable and the middle phalange for the distal, and there's your measurement. And you can literally go like this, right across, and take your measurements, okay? So she's at 100 and about 108 degrees, which 110 at the PIP is normal. And then you just slide down here to the DIP, same thing. And we've got about 68. So these are really quick and easy to measure. There's a lot of measurements. So if you got somebody that can write them down for you, or you're really good about putting them in quickly in the computer when you're doing an evaluation. So just think about, with your little goniometer, the stable arm is going to go on the proximal, either the metacarpal, the proximal phalange, or the middle phalange. And then your movable arm is going to go distal. Does that make sense? Very quick and easy. We'll let you guys practice those. Make sure that you practice MP extension on the volar side, just so you know how to do it. Okay? All right, we'll give you guys a few minutes to practice that, and we'll come. Okay, so what are the three joints? Carpometacarpal, metacarpophalangeal, and interphalangeal. Okay? You will rarely isolate the CMC joint, if ever, so we're not going to do that. We will do palmar abduction and radial abduction. Okay? I'm not going to confuse you by telling you what it is in other books. It is palmar abduction away from the palm, radial abduction away from the radial side of the hand. Okay? Palmar abduction, radial abduction. Okay? All right. So the first thing we're looking at is MP, the thumb MP flexion. And again, not doing extension. What you wind up with the extension is you get a lot of hyperextension, and it's really hard to measure. So generally in the clinic, I will, if I'm seeing them for their thumb, I will take an extension measurement on the dorsal part of it, not on the volar. But it's really hard to do hyperextension. So if you've got somebody that has a huge amount of hyperextension, I go lateral. Okay? You're not going to be tested on it. I'm just showing you so that you know that it's out there. Okay, so MP flexion. Ask them to try and touch the base of the small finger and slide their thumb down as far as it'll go. Okay? Again. Ow. Stable arm goes on the metacarpal. Movable arm goes on the proximal phalanx. And the axis is over the dorsal part of the joint. Okay? At 60 degrees. 0 to 50 is normal. Okay? Can you? Okay, so the IP joint, if you try and get them in here, it's really hard to do. So I just bring them up here like this and have them bend the IP joint. And again, same thing. Loosen your goniometers up so that they slide real easy. Okay, same thing. Are you guys seeing a trend with this? It's very easy to measure digital motion. Okay? All right.
That's the interphalangeal joint, and this is the
Metacarpophalangeal. So it's the same, MP. These are all MP joints.
okay.
Here. You just only
So
have
this is a
one
proximal.
interphalangeal. There's only one, so it's just an IP joint. Okay? So, palmar and radial abduction. If you'll notice on the slide, radial abduction, do you see where they have the stable or the stationary arm? I don't measure it like that. Again, you see I even bolded it. Alternate position. You can do it either way. The alternate position is the easiest way, okay? Because you measure, I don't know why they do this one particularly. Radial abduction and palmar abduction can be, again, measured very quickly, very easily, okay? So if we're gonna start with our radial abduction, your axis is going to go at the carpometacarpal joint. Do you know how to find that? It's right around the anatomical snuff box. Okay? Your stationary arm is going to go up your second metacarpal, and your movable arm is going to go in line with your thumb, okay? So I just hold it here, and I tell her, can you slide your thumb out as far as you can go? Perfect. Again, do you see my hands? I'm gripping the goniometer on either side at the joints. Just, wow, 62 degrees of radial abduction.
That's right.
She's gonna have bad thumbs. Yes, ma'am.
Are you starting at 0 for that or
No,
no?
we don't have a starting point.
Oh,
Okay, the starting point is just here. Okay, so I'm not gonna ask you for where are we starting at, where are we ending,
so, okay.
because we can't get the thumb up here on a 0 point.
So you don't have to do math, so?
No,
You don't-
no math.
That was the question. That was the question.
No math.
20.
Okay, so that's your radial abduction. Any questions on that? Palmar abduction, you're gonna have them up on their side, and you're gonna have them bring their thumb away from the palm, straight out. Make sure that they go straight out, not up and out, okay? Again, your CMC joint, your stationary arm is along the lateral aspect of the second metacarpal, and your movable joint, or movable one, is along the thumb, okay? So bring it straight out from your palm. And look at this. You've got some bad thumbs, girl.
That's right.
Okay, so she's almost at 70 degrees.
They're all crooked. Look at all crooked they are.
So, always remember, radial abduction is straight out from the radial side of the hand. Palmar abduction is away from the palm, okay? All right, try the MP, the IP, radial. You touch your thumb, the tip of your thumb to the tip of your small finger, okay? If they can't, tip, okay? If they can't, you're going to measure, I don't have my glasses, oh yeah I do, they're in my head. Okay, so try and do it. If they can't, you're actually going to take your little ruler that we cut off your goniometer, that's why I gave them back to you, and you're gonna measure between the tip of the thumb and the tip of the small finger, okay? And you're gonna put that in there. So 1 centimeter.
So we measure with centimeters, is that what you're getting?
Centimeters are always gonna be more accurate, okay? Quick and easy.
What do you do to yeah, should we
If
fade
you
it?
can, patient able to oppose, thumb, small finger.
For our PowerPoint, do you want us to fake it?
Yep, fake it till you make it.
Okay.
Okay. Therapy setting is could you go to the next slide? It's called the Carpometacarpal scale. Okay? If they can oppose to here, it's 0, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this is what the hand surgeon's like, because it's really much more accurate. Okay? You will not be tested on this. It's for your information. This is why you guys got lucky you have a hand therapist teaching you this stuff. So I'm gonna give you a lot of stuff for your information, okay? So, again, 0, think of it as the MP joint, or the PIP, the DIP, the tip. On the 3rd and 4th, there's a very specific way that you're supposed to do this, okay? All the research done on norms for grip straight is on rung number 2. 1, 2, 3, 4, 5. Okay, rung number 2. You will get this back from the PT counterparts, and they do it on rung 3. So make sure you put it back on rung 2. Okay. So when you want to test your patient, can you turn facing me, please? You want to tell your patient, I'm going to be testing your hand strength today. This is called a Jamar dynamometer. You're going to be squeezing this, but when you squeeze it, it doesn't feel like you're doing anything. So if you watch the dial and I squeeze it, you see it change. okay? It's gonna be the same thing for you. We take an average of 3 because the first time they squeeze, they usually don't realize that they're not squeezing. Okay? So, I always tell my patients I need both feet flat on the floor. Elbow is at your side at a 90-degree angle. Sit up nice and straight and tall. All right? Squeeze, 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 squeeze. 3 times. You say squeeze, squeeze, squeeze. Don't release it. Just squeeze, squeeze, squeeze. Those are that's your dialogue for them. Okay? So she got at 60 pounds. Let's try it again. And squeeze, squeeze, keep squeezing. Squeeze, squeeze, squeeze. Good. And relax. 66, one more. Squeeze, 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 relax. And 60. Okay?
Do you test both of them?
Yes.
Okay.
You're going to test both hands. The different rungs are so that you can determine, well, for one thing, like if you've got a child, you want it smaller. Somebody that's got larger hands, you want it larger. But you can test them on each rung, and you should have a bell curve. Okay? If you don't, they're not giving maximum effort. The other thing you can do is called a rapid exchange, where you go squeeze, 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 5 times on each. You watch where it's going, and a lot of times if people are not giving maximum effort in the primary test, you'll see them just because they're doing it without even thinking about it, giving maximum effort. And you'll see 1 or 2 that hook up or go up. All right? Yes?
So do the ROMs, do they add resistance or do they add, like what are they?
It's the distance of your fingers.
So what is PT does 3 and we do 2?
I don't know. I truly cannot tell you.
We have norms too, so like you would look up her age, she's a female, and she's supposed to be around the norms. I'm sure she is, I think 60 pounds.
Yeah.
That was my weekend.
Excuse
Oh,
me.
all right.
Oh.
I'm incredibly weak.
Yeah, she's got 82 on the other.
Whoa.
Okay.
She got the farmer hand.
All right, so this is what we do to test hand strength.
How old are you? 26.
Oh, they're little babies.
These norms,
You're so red.
Older on
You're so red. You're so
You and I
fresh.
are the same age.
these norms are from 1985. Do you think the norms have changed since 1985?
63 for left, 74 for right.
So you were average.
Can
for
you
your
use
last
2
one.
different ones?
No.
Oh, it's the same.
You always want to use the same ones. You should be using the same one in the clinic. These have to be calibrated every year.
Oh, we're not using that today? We're not gonna.
He wants to do a bro tea contest.
You guys can,
I'll
while
lose,
you're
it's fine.
doing your measurement for opposition, you guys can come up here and use these. These have just recently been calibrated. They are very expensive instruments. Do not drop them. Do not bump them. If you do, you're going to pay for them. Okay. It took me a long time to get just to have these calibrated. It was $1,800 for all of them. So it's not cheap. And anytime that you drop it or you hit it on the table, it can throw it off. So be very, very careful with them. Okay.
With that one, would you have to accommodate for a left-hand dominant person with the right hand?
No, what you do is you just understand that generally speaking, your dominant hand is about 10% more than your
Okay.
non-dominant hand.
Okay.
Okay? So that was full composite grasp. Ugh, can't talk anymore. This is what we call a pinch meter. Okay? When you use the pinch meter, this goes around your wrist, so if you happen to drop it, it stays in your, not on the floor, in your hand, so to speak. Okay, let me get it zeroed. Does everybody know the 3 different pinches that we test?
Wait.
What's this one?
Please don't choke.
Okay. What's this one?
Pincer.
Okay. What's this one?
Oh yeah, key. Is it, what are they key?
Okay, so they're called all different things. Lateral pinch, 2-point pinch, 3-point pinch. Okay. Lateral is also called a key pinch because that's how you turn a key. 2-point is also called a pincer. Don't know why exactly. And then 3-point is also called 3-jaw chop. To me, it's easier lateral, 2-point, 3-point. Okay. So The idea is when they're doing this testing is that their forearm or their hand is in a neutral position. Okay? So I'll start with the lateral pinch. And what I do is, okay, we're gonna test your finger strength. Can you make this here? And pinch down with that thumb. Pinch, pinch, pinch. Good. And relax. And she got 21.5 pounds. Okay? Then we're gonna do this pinch here. Make sure that you keep your thumb nice and strong. And pinch. You see her thumb right here? That's bad.
What's that from?
You have a weak ECR. EPB. I can't even talk. I'm sorry. It's been a long week. Who knows what the EPB is? Extensor pollicis brevis. It brings the MP joint back. Everybody uses the EPL.
Oh, is that with the, so the hitchhiker thunder have a week?
So you work on trying to get this position to strengthen that EPB and to support it in a good position. Okay, so we did the 2 point or the 3 point, and then we're gonna do the tip to tip. And pinch, pinch, pinch. Okay.
You know.
Do the 2 point. 2 point. Or 3 point, I'm sorry. So she had about 8 pounds for the 2 point, and she's got about 18 for the 3 point. Okay. Any pain with that? Yep. So this is what you do to strengthen that. All right, so these will be out here. We have a different